I can teach you guys topics and you guys can make your own informed decisions.
The AOD 9604, are we supposed to be taking it on an empty stomach? Can we have coffee beforehand or after? How long after you have the AOD can you eat? What about like a tablespoon of unsweetened almond milk?
So there's no data on this, right? But the concept of being fasted is the same when it comes to growth hormone secretagogues. But because we don't have research one way or the other, most people agree, let's play it safe, and they basically treat it like it is, and they give you that same advice. Remember, AOD is not something like GLP-1 med or any other drug that you can tell you're taking something. Like AOD is certainly like you're
Right.
like, yeah, it's just some people notice like more energy, um, maybe a little bit more
Yeah, I didn't
appetite,
notice
but
anything.
yeah. So it's definitely one of those things where you have to just know it's doing what it's doing.
When I was taking, I don't know what it's called, the Tirzepatide.
Tirzepatide.
I was having, I did fine on it for a little while until we did an updose. And then my problems started happening where I was getting dizzy, started vomiting, nausea, diarrhea, headaches. So is there something else I can do?
Yeah, don't take the same dose again next week and let you just write it out right now, you know. So I can't, as always, I can't give medical advice on telling you what to dose, but generally speaking, when the medication is hitting you that hard, the two options that people tend to do is either, I guess three options will be just stop because it's so bad and not take it next week, or take a lower dose next week, or take the same dose, right? Like those would be the three possible paths, and you're going to have to figure out what you want to do. But and it's obviously going to depend on how bad exactly it is. But generally speaking, the path that most people, at least in our group, working with our practitioners, find that works best for them is letting their body react to it, let that kind of reaction calm down, which it should calm down after, because the half-life of the medication, it runs out about a week, right? So a week passes, you're kind of through it, and taking a lower dose would make sense, right? Giving your body more time um to yeah. So let's talk about this couple concepts I want to talk about. Increasing, and there's a lot to say about increasing as well. Remember, the only reason to increase your medication is because you feel like you're not able to implement the protocol. That's it. That's it. Like we're not treating diabetes here. We're not like that's a whole different story. When you're trying to that's a whole different thing. But if we're not treating diabetes, the point of this medication is to help you implement lifestyle choices. So we have a generic template of tirzepatide, 2.5 for 4 weeks and then 5, but that's not necessarily the path that you need to take or have to take, right? So, and truthfully, as I continue, because you guys know how much I continue to study this and look at this, I'm even discussing with my with my practitioners of maybe even having a path where people start even lower than 2.5. You know, it's as this thing continues to evolve and as I study and learn more and more, 2.5 for 4 weeks and 5 is just kind of a protocol that a lot of people do out there. Doesn't mean you need to start at that path and follow that per se. So I've been talking more about that lately, and more people are starting to realize, well, if I feel great at 2.5 and I'm implementing the protocol and, not saying that it's easy, but I'm adhering to it, no need to go up. And I support that 100%. So in your case, Sarah, you're kind of feeling the big punch to the face of the dose you did. And so it sounds like you're going to choose to go lower. And I think that's a great idea. It makes sense going back to 2.5. Just keep in mind that at a week, if you still feel horrible, then maybe take more time off, right? But once you get back to kind of baseline, going back to base, ask yourself that question, right? Do I need more than 2.5 to implement the protocol? That's the biggest question. And If you didn't need to go more, then I would just stay at 2.5. And if you feel like, yeah, you do need more, then maybe don't go up to 5. Maybe go from 2.5 to 3.5, right? Like 35 units. Like you can titrate at any rate up or down that you feel makes sense for you. It's like you can titrate at any rate up or down that you feel makes sense for you. Does that make sense?
She was doing
Oh.
really, really good on the lower dose, and she lost 20 pounds
Yeah.
and had no problems fasting. So, but we just thought you were supposed to go up.
No, I get that. And, unfortunately, with these prescriptions, you can't write things like make a decision on your own to go up. Like it'd be awesome if you can write that. And that's why you guys are in this program, to get coaching, to learn, to take control. I can't give you medical advice either, but I can teach you guys stuff. I can teach you guys topics, and you guys can make your own informed decisions.
I think research or thinking about starting out at a lower dose would be great for like people like me. I think I could have started out on half the 2.5 and it would have greatly affected me, because it really, really hit me hard and made me really weak and fatigued and tired. And I think that's great. Yeah.
It's such a no, this is new, right? Like as I continue to port the data and look at how many other gosh, there's so many medical conditions right now that are being studied with these medications, and what people are. We're seeing cardiovascular, heart growth, neurodegenerative disease, addictive diseases. I mean, it's amazing. And then I'm starting to look at this and realize, like you said, like, a lower dose at even 2.5 might have been a phenomenal thing, might have been enough for some people. I'm at the point now where I realize, just from what I'm seeing, that there's an obvious correlation between, the more dose an individual has to work up to get to, just all that means is that, and for them at that time in their life, right? Because your health changes as time progresses, as stress levels change, yada, yada, yada. How much medication an individual needs for them at a given time to really kind of shut down that food chatter and gain control is definitely correlated with how metabolically sick that individual is at that time, right? And so for people starting this that are less metabolically sick, yeah, they might do great with even lower than 2.5, or at least that might be a good starter dose to then work up to 2.5, right? So yeah, changes are coming for sure as I get with my medical practitioners, and we might start kind of establishing even a lower protocol for people. But a lot of people that I've seen have done great with 2.5 too, though. If it takes 150 units of tirzepatide, which is the maximum dose, right? 15 milligrams, as much as we want to stay away from something like that.
Yeah.
If that's what it took for an individual to get through that first 2 to 4 month barrier and have control, that would still be a better scenario in my books than being stuck altogether. So keep that in mind. I think that's what we need for you.
The AOD 9604, are we supposed to be taking it on an empty stomach? Can we have coffee beforehand or after?
Yeah, so there's no data on this, right? But the concept of being fasted is the same. When it comes to growth hormone secretagogues, right? Meaning things that increase growth hormone, which I'm a big fan of, by the way. It's a good, usually some people transition from AOD to those growth hormone secretagogues like Semorolin, Tesamorolin, CJC 1295, Ipamorolin. With those, what those are doing is increasing growth hormone. And when you increase growth hormone, any insulin secretion will negate those effects, decrease them, right? So the best way to know you're not spiking insulin is to not eat, right? So you always have that advice with growth hormone secretagogues. AOD is not increasing growth hormone. But because we don't have research one way or the other, most people agree, let's play it safe, and they basically treat it like it is, and they give you that same advice. So I take that same advice. I think it makes sense, just in case. And so we treat it like it is, and we say, hey, we want to keep your insulin levels as low as possible to maximize the benefit. And so coffee, if it's just black coffee sweetened with stevia or monk fruit, isn't going to spike your insulin. So that's fine. Right.
Okay.
So we say fasted to play it safe, but anything that won't spike your insulin is probably fine when you're taking AOD.
And how long after you have the AOD can you eat, would you say?
Yeah, you know, the longer you wait, the better, obviously, always, but I'd say like 2 hours is probably a
Okay.
good metric to get that benefit of the AOD, maximal benefit.
What about like a tablespoon of unsweetened almond milk?
I'd say that's fine, right? Because unsweetened almond milk should just be pure fat. It's
Okay.
low calorie and the calories
Uh-huh.
are fat, so that's fine.
Okay, thanks.
Yeah, technically speaking, even a fat bomb with 100 calories of fat or 200 calories would probably still be fine. Now, the only thing that I would think of there is like, well, now you're burning fat from the food, and that's less ideal. But for people that are not on the meds, needing more support, fat bombs are probably your cheapest potential appetite suppression there, right? Because think about it, if you had to eat, let's say 400 calories of fat spread out, you know, MCT oil, coconut oil, or any other pure fat source for that matter, if you had to eat 400 calories to help you get through a 48-hour fast, that's a phenomenal scenario because you burned a hell of a lot more than 400 calories in a 48-hour fast. And pure fat can really help satiate you and suppress your appetite. It's not ideal, which is why I have all those other upper things above it, like the Unimate, the Balance, the Cali Curve, the nicotine gum. But the last thing I have on that list, guys, are fat bombs. And a fat bomb is basically any high quality fat. I don't care what it is. Now, an avocado is sort of a weird situation because the carbohydrate intake isn't, I wouldn't say it's high, but it's certainly not low. But the majority of carbs from an avocado is fiber. And so I'm okay with a small piece of an avocado too, to help you if you're really struggling with hunger, especially when you're new to this program, especially when you're just getting started. You do whatever it takes to get into your fasting. As you start progressing, becoming more of a veteran, developing some more metabolic with flexibility, then you can start challenging yourself, relying less and less on food, right? And hopefully just like whatever sort of suppression support you're using.
So I have been at a plateau for a very long time now.
Yeah.
On the flip side of that, I'm not gaining weight and I'm having no problem. I've been off the meds, I don't know, 3 months. Yeah. And I'm having no problem. No food
Maintaining.
chatter. Yeah, I continue to fast 48 hours almost every week. I retired in the last 6 months. And so sometimes we're traveling or what have you, and it's just, inconvenient to do the 48-hour fast. But I'd say 85% of the time I am. No problems. I mean, I'm not saying it's simple. I'm able to do it without stress. And without gaining, I'm not gaining weight. I'm totally able to maintain this weight, which is about 30 pounds less than when I started with you a year ago, which is great. But I'm still 25 pounds away from my goal weight, and I am so stuck. And I've tried, all the different suggestions. I would really like to get on the phone with somebody from your staff or yourself and talk about what I can do.
I know you've done some of the basic reset stuff and it doesn't seem to be working. Have you stopped the weekly fasting as part of the reset, or have you kept the 48-hour fasting going during the resets?
So I've done a month where I stopped the 48-hour fast. It was almost a month. I want to say 28 days. I've done switching my fast to different days because for almost a year I was fasting Monday, Tuesday. So now I've switched, been fasting Thursday, Friday.
Okay.
I've gone to count, I got an app and I'm counting my calories. I'm making sure I've got enough protein and fats.
With the month, did you stop the long fasting though? I'm okay with intermittent fasting, but have you ever taken a break from long fasting entirely?
Completely for about 28 days.
Yeah. Okay. So in that scenario, when you did 28 days, you only did intermittent fasting. You were counting your calories.
If that, I didn't always intermittent fast.
Okay.
We were in Europe. I was on vacation. I just did what I wanted. I only gained about 5 pounds.
Yeah.
And when we came back that first week, I did the 48-hour fast, lost about 6 pounds. And then the next week when I did my 48-hour fast, I lost about 2 pounds. And then I have hovered within 3 pounds of the same weight of where I've been plateaued for.
Yeah, I think what there needs to be, I think what's happening is you're coming, and again, like Ceci will put you on a Zoom with me and we can go more in depth. I think what's happening is you still have some insulin resistance. There's obviously some of that still there. The reset is that first step, but I think what's getting lost or hiccuped is after the reset, transitioning off of that and not having you kind of go back into another plateau. That's where we need to kind of work together to get you through that. But when you get out of that, I think that's going to be the thing that we're going to have to change what you did last time after the reset to prevent you from going back into it. Whether it means more hardcore keto, whether it means something is it an inflammation issue? Is it a cortisol issue? We got to figure out what it is that's kind of keeping you. Because 48 hours per week to maintain weight, I think is too much for most people.
And I'm at this for a year. And I just came over me, I don't want to do this for the rest of my life. I don't want to fast
I'll tell you this, even though we're not losing weight, some miraculous stuff is happening to your body from doing the 48-hour per week, a lot of cellular autophagy. So we're doing a lot of cleansing, but there's something still holding that insulin resistance in place, which is why that set point is kind of stuck. And so this is where we can get you on. So yeah, till we get you through that next step.
Thank you.
Absolutely. And guys, that's the big difference between the warrior and the student, right? So this is the group that everybody's on, students and warriors. But the big difference is the warrior gets you get a higher level of access, and we will put you on more intimate Zooms, whether it's one-on-one or a small group, to keep you moving if you're stuck, right? If you can make the student work because your body is smooth and this Zoom is enough for you with the group, great, do that. But if you need stronger hand holding or you want that accountability, higher level, that's what the warrior gets you guys.